If your urine ever looks like beer foam and it just sits there, you might be seeing the very first warning sign of kidney disease, and most people miss it. This single symptom has saved lives, but only when people knew what to look for. Stick with me for the next 15 minutes, because what you learn about foamy urine today could literally save your kidneys. Welcome to Health Zone, where we decode your body's warning signs before it's too late. I'm here to give you the medical facts that could change your life. Today, we're talking about foamy urine, a symptom that 90% of people completely ignore, yet it's often the first and only warning sign of serious kidney disease. By the end of this video, you'll know exactly when foamy urine is dangerous, when it's harmless, and what action to take if you've been noticing the symptom. Here's the shocking truth. Kidney disease is called the silent killer for a reason. You can lose up to 90% of your kidney function before you feel sick. But your urine? It might be trying to warn you years before other symptoms appear. If you've ever looked down and wondered why your urine looks foamy, or if someone you care about has mentioned the symptom, this video is absolutely critical. Let's dive in. Number 1. What exactly is foamy urine? Let's get clear on what we're talking about. Normal urine might have a few bubbles when it hits the water. That's completely normal, especially if you urinate with force. These bubbles disappear within seconds, just like when you pour water into a glass. But foamy urine is different. We're talking about persistent, soap-like foam that sits on top of your urine for minutes, even after you flush. It can look like the head on a beer or the foam you get when you whip egg whites. This foam doesn't disappear quickly, it lingers, and that persistence is what makes it significant. Why does this happen? Your kidneys are incredible filters. Every day, they process about 50 gallons of blood, removing waste while keeping the good stuff, like protein, in your bloodstream. Healthy kidneys have tiny filters called glomeruli that are so precise, they keep protein molecules from leaking into your urine. But when these filters get damaged, whether from diabetes, high blood pressure, or other kidney diseases, protein starts leaking through. And protein in urine creates foam, just like when you add egg whites to a mixer. The medical term for this is proteinuria, and it's one of the earliest signs that your kidneys are in trouble. Here's what's scary. This can happen years before you feel any other symptoms. While you're going about your daily life feeling perfectly fine, your kidneys could be slowly losing function. That foam in your urine might be your only clue. Number 2. The hidden kidney connection. Let me share Sarah's story. Sarah was 52, a busy mom who noticed her urine had been foamy for about 3 months. She mentioned it to her sister, who said, "Oh, that happens to me sometimes too." So Sarah ignored it. She felt fine. No pain, no fatigue. 6 months later, Sarah went for her annual physical. Her kidney function had dropped to 60%. She'd already lost 40% of her kidney function and was officially in stage 3 kidney disease. If she had acted when she first noticed the foamy urine, they could have caught it much earlier and potentially slowed the progression significantly. This is why foamy urine matters so much. According to the National Kidney Foundation, about 1 in 10 adults has some degree of proteinuria, protein in their urine, often years before they develop obvious kidney disease symptoms. And most of them have no idea. Your kidneys are what doctors call silent organs. Unlike your heart, which might give you chest pain when it's in trouble, or your stomach, which might hurt when something's wrong, your kidneys can be failing quietly for years. You can lose up to 90% of your kidney function before you start feeling sick, tired, or notice swelling. But your urine? It's like a daily report card from your kidneys. And foamy urine is often the first item on that report card that says, "Hey, we need help up here." A study published in the Journal of the American Society of Nephrology followed over 10,000 people for 20 years. Those who had persistent proteinuria, even mild amounts, were 5 times more likely to develop kidney failure later in life. That's a massive red flag. Number 3. When to worry versus when it's normal. Not all foamy urine means kidney disease. There are several normal reasons for foamy urine. Normal causes. 1. The speed and force of urination. If you're in a hurry or have been holding it, the force can create bubbles, especially common in men. These bubbles disappear within 10 to 15 seconds. 2. Dehydration. When you're dehydrated, your urine becomes concentrated, which can create more bubbles. 3. Toilet cleaners. Some cleaning agents can react with urine to create foam. 4. Retrograde ejaculation in men, where semen enters the bladder. Harmless, but can cause temporary foam. Red flags. 1. Foam persists for more than 30 seconds and keeps happening for 2 weeks or more. 2. Foam is especially noticeable first thing in the morning. 3. You're also experiencing swelling around eyes, hands or feet, fatigue or changes in urination, going more at night, darker urine or strange smell. Home test. Pay attention to your first morning urine for a week. If it's consistently foamy and the foam lasts more than 30 seconds, and this has been happening for 2 weeks or more, it's time to call your doctor. Don't wait for other symptoms. Significant kidney damage may have already occurred by then. Number 4. Other warning signs your kidneys are in trouble. Foamy urine rarely travels alone. If your kidneys are starting to fail, there are usually other subtle signs. 1. Morning puffiness around your eyes. When kidneys can't remove excess fluid, it shows up as puffiness, especially after lying down all night. 2. Swollen ankles and feet, called edema. This is a classic sign. If pressing your finger into your ankle leaves an indentation that takes a few seconds to bounce back, that's concerning. 3. Getting up to urinate more than twice a night. Healthy kidneys concentrate urine at night so you can sleep. Failing kidneys mean more nighttime trips. 4. Persistent fatigue. Kidneys produce erythropoietin, which triggers red blood cell production. Number 5. Who's most at risk? Ethnicity is a factor too. African American, Hispanic, Native American, and Asian American adults are at higher risk for chronic kidney disease, often due to higher rates of diabetes and high blood pressure. Other risk factors include obesity. Excess weight strains the kidneys over time. Smoking damages blood vessels and speeds kidney decline. Frequent NSAID use. Painkillers like ibuprofen and naproxen, when used regularly, can damage kidney tissue. History of urinary tract infections or kidney stones. These can cause scarring and reduce kidney function. If you fall into any of these categories and notice foamy urine, you should be especially proactive about getting checked. Number 6. What your doctor will do. If you go to your doctor with foamy urine, here's what you can expect. 1. Urinalysis. The first step is a simple urine test. This checks for protein, blood, and other abnormalities. 2. Urine albumin to creatinine ratio, UACR. This measures how much protein, albumin, is leaking into your urine. Even small increases can signal early kidney damage. 3. Blood tests. Your doctor will check your creatinine and calculate your estimated glomerular filtration rate, eGFR. This tells you how well your kidneys are filtering waste. 4. Blood pressure check. High blood pressure is both a cause and a result of kidney problems, so this will be closely monitored. 5. Imaging or further tests. In some cases, an ultrasound or CT scan might be ordered to check for structural problems. The good news? These tests are simple, painless, and covered by most insurance. Early detection can dramatically slow or even halt the progression of kidney disease. Number 7. How to protect your kidneys. Whether you're at risk or just want to keep your kidneys healthy, here are proven strategies. Stay hydrated. Aim for at least 8 glasses of water a day, unless your doctor says otherwise. Control blood pressure. Keep it below 130/80 millimeters of mercury if possible. Manage blood sugar. If you're diabetic, tight control can prevent or slow kidney damage. Eat a kidney-friendly diet. Limit salt, processed foods, and excess protein. Focus on fruits, vegetables, whole grains, and healthy fats. Be cautious with painkillers. Only use NSAIDs when absolutely necessary and never exceed the recommended dose. Don't smoke. Smoking speeds up kidney decline and raises your risk for heart disease and stroke. Get regular checkups. If you're over 45 or have any risk factors, ask your doctor for annual kidney function tests. Here's a fact that surprises almost everyone. Over 37 million Americans have chronic kidney disease, but 9 out of 10 don't even know it. Why? Because early kidney disease has almost no symptoms. Unless you're paying attention to subtle signs like foamy urine, studies show that people who catch kidney disease early can cut their risk of kidney failure in half. That's why it's so important not to ignore what your body is telling you. If you've noticed persistent foamy urine, don't wait for it to go away on its own. Early action is the difference between a simple lifestyle change and a lifetime of dialysis. Don't gamble with your health, get checked. Have you or someone you love experienced foamy urine or other kidney warning signs? Share your story in the comments. Your experience could help someone else catch kidney disease early. Like this video, comment below, and subscribe for more life-saving health info. Because your health is worth fighting for. And let us know, what kidney topics should we cover next? Thanks for watching Health Zone. Remember, your kidneys are silent heroes. Don't let them become silent victims. Take charge of your health today, and see you in the next video.